Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. Topic of today is cellulitis. By definition, cellulitis is a bacterial infection involving inner layers of the skin or the deeper layer of the skin. It affects dermis and subcutaneous tissue. It presents an area of redness which increases in size over time if not treated. The borders of the area of the redness are generally not very sharp and skin is swollen. Redness turns white when pressure is applied on the red area. The area of the infection is usually painful. Lymphatic vessels are involved. Person have a fever and feel tired. It can occur on any part of the body, but mostly the legs and the face are mostly involved. Leg is typically affected after a break in the skin of the leg, so causing cellulitis. So here one can see in the leg, and the other very common part is the face. If there is any break in the skin of the face, there is cellulitis of leg and face. Here again one can see that the leg is involved and the fingers are very much damaged because of the pressure of the cellulitis, and one of that is going to be having the gangrene, and there may be the amputation of this finger because of the lack of blood supply, and it is dead. Here again one can see on the finger, on the eye, upper eyelid, and on the face and the nose, these are all cellulitis which are very commonly seen. Now, the risk factor of the cellulitis are trauma to the skin, injury, any cut, fracture, burn or scrap gives bacteria an entry point and to cause the cellulitis. An insect, animal or the spider bite, tattoos, they are also responsible for causing cellulitis. Injecting drugs, subcutaneous or intramuscular injection or intravenous injection, when misses, when they leak, they can also cause the cellulitis. Certain medications that weaken the immune system of the body, these also predispose to cellulitis. Obesity, aging, pregnancy, these are also the risk factor, and here the cellulitis is more found and seen. Circulatory problems, not enough blood flow to the arms and the legs, those with the poliomyelitis, so they have the approximated blood supply and they are prone to have cellulitis. Here one can see the types of the skin injury, that could be the wound, the stitches that have been applied, then there is cuts and the bruise, abscess, and this all the bites and abrasion, these are responsible for causing cellulitis. Infection from the insect bite on the exposed part, that is also causing the problem. Similarly, it can be seen on the hand by the cut or any injury on the hand. Tattoos, these also predispose because these are just a kind of punctured wound and they can be responsible for that. And similarly, I have told you the poliomyelitis, because of the approximated blood supply, they are also prone to have this problem. The risk factors continuing, weakened immune system like diabetes, leukemia, HIV and AIDS are also the risk factor. Diabetics especially prone to cellulitis in feet. Disease causes impaired blood circulation in legs leading to the diabetic foot or foot ulcer, and poor control of the blood glucose levels allows bacteria to grow more rapidly in the affected tissue because these tissue are having lot of sugar, which is a good medium for the bacteria, and they grow very rapidly there. And infection enters the bloodstream. Neural degeneration in the diabetes means these ulcers are not painful, thus become infected because person does not feel pain and does not care the feet and the ulcer. So these are going to become infected because of the neural degeneration. Poor drainage of the veins or the lymphatic system, lymphedema also is one of the risk factors. Here one can see the diabetic foot, the artery, the blood supply that is just approximated, and as one can see, the less blood supply to that area that predisposed to infection and that leads to the ulcer formation there. So that reason is the hampered or approximated blood supply which is responsible for causing the ulcer and the infection. Diseases that affect blood circulation in legs and feet, like chronic venous insufficiency and varicose veins, are also the risk factor. Varicose veins are the twisted and large veins near the skin surface. Liver disease like chronic hepatitis or cirrhosis, and skin disorders like eczema, psoriasis, or infectious disease with sores like chickenpox, and the athlete foot and the shingles that cause break in the skin and ultimately lead to the cellulitis formation. Here one can see the varicose veins and the psoriasis and the eczema and chickenpox rash. These are also causing the break in the skin, and the athlete foot one can see the macerated skin and the broken skin, and the shingles, herpes zoster, that also break the skin because the blister comes out through the skin. So these are predisposed to causing the cellulitis. The other risk factors are history of cellulitis. Having had cellulitis before increases the risk of getting it again. The person having the positive history of cellulitis is or she is prone to have the cellulitis again. Similarly, the person with burns and boils rarely hidradenitis suppurativa or dissecting cellulitis, and dense population like as in the military installation, college dormitories, nursing home, etc., where there is poor hygiene. These are all predisposing factors for cellulitis. Here one can see the first degree burn, the pimple, the boil, and the hidradenitis suppurativa in the armpit that is also responsible for spreading and leading to the cellulitis. In the past, we used pencil when we were small, but now we use pens. Why? Because mistakes in the childhood can be erased, but mistakes at this age, when we are young enough, cannot be erased, and that have to be taken seriously. Now, what are the causes of cellulitis? Injuries that tear skin, I have already told you. Infections after the surgery, foreign objects in the skin, causing the break in the skin, bone infections underneath the skin, long-standing, open wound, deep enough to expose to the bacteria. Group A, Streptococcus and Staphylococcus are the most common and notorious causes as found on the skin as the normal flora, and they can just have entry very easily to the underneath skin. Here one can see Streptococcus pyogenes, these are in chains, Staphylococcus aureus, these are in grapes, and here one can see these are causing the cellulitis of the foot, small ulcer, and leading to the infection. Basically, the infection spreads under the skin. On the skin, it is ulcer, but most of the time, the infection spreads under the skin, and that gives the red color of the skin very hot, and that just gives you the suspicion of cellulitis. Other causes, in 80% of cases of Ludwig angina or cellulitis of the submandibular space are caused by the dental infections. Mixed infection due to the both aerobes and anaerobes are involved in this cellulitis. This includes alpha hemolytic streptococci, staphylococci, and bacteroides group, which are anaerobes. Also involved are Pasteurella, Haemophilus influenzae, Helicobacter pylori, sometime and rarely. Here one can see the cellulitis, the infection goes so deep from epidermis, dermis, and to the subcutaneous fat. If we do compare it with the recipilas, so the infection goes only to the dermis layer but not to the subcutaneous fat. And here, in case of the abscess, it is the pus which is just in a sac and that is limited to the dermis and it have not gone to the subcutaneous tissue or subcutaneous fat. So the type of the cellulitis, rarely I have told you, these are Haemophilus influenza cellulitis that is seen mostly on the cheeks of the children, and that is because of the Haemophilus influenzae. So if one do see this kind of situation, keep in mind please the Haemophilus influenzae that can cause this kind of cellulitis. Similarly, rarely Helicobacter cellulitis occurs in case of the leg cellulitis. So that is a rare variety, but one have to keep in mind that Helicobacter pylori sometimes causes the cellulitis in the legs, as one can see here. Position of the husband is like a split AC, no matter how loud he is outside, but inside the house he is designed to remain silent, cool, and controlled by the remote control, which is always in the hand of the wife. So no need to be annoyed because your remote is with the wife. Now, what are the symptoms of the cellulitis? Cellulitis usually occurs on one side of the body: red, hot, painful area of the skin, high fever or the chills, nausea and vomiting, redness, red streaks, swelling, warmth, pain or tenderness, leaking of the yellow clear fluid or the pus from the wound, and enlarging or the hardening of the reddened area and numbness on touching that. So here one can see the redness, pain, swelling, heat, and redness travels, worsening the pain, more swelling, skin is tight, and it just impairs the circulation, leading to the gangrene sometime. Here one can see the cellulitis bulli are seen, that skin over this cellulitis that have got the bulli or the fluid containing abscess or the area with the fluid inside, which are called bulli. So common symptoms of the cellulitis are redness, red streaks, swelling, pain or tenderness, warmth, leaking of the yellow clear fluid. I have already told all these. Now what are the complications? That is abscess formation, bacteremia, endocarditis, osteomyelitis, toxic shock syndrome, or the sepsis. Infection can spread to the deep layers of the tissue called facial lining, so the necrotizing fasciitis or the flesh-eating bacteria are responsible, causing the necrotizing fasciitis. Recurrent episodes of the cellulitis damage lymphatic drainage system and cause chronic swelling of the affected limb, causing the lymphedema of the leg, as one can see the huge elephant-like limb, that is the lymphedema due to the blockage and the pressure over the lymphatic vessels, and lymph is not able to get back into the venous system, so this is going to be a lymphedema. Here again one can have the skin, and that is the pus inside, and that is forming the abscess, and that is one of the complications. Similarly, necrotizing fasciitis, the flesh-eating bacteria, and it's a surgical emergency, and these are just going to cause this kind of the infection, which is very serious and leading to the gangrene sometime. Now, what are the diagnoses? Medical history and the physical examination. Cellulitis have a characteristic cobblestone appearance indicative of subcutaneous edema, inflammation of the regional lymph nodes, a blood test or the culture to check spread of the infection to the blood, and X-ray if any foreign object is in the skin or the bone underneath is infected, that also do help. Bedside ultrasonography performed to discriminate between abscess and cellulitis, and in case of the antibiotic failure without a defined hypoechoic heterogeneous fluid collection that would indicate abscess, test to rule out blood clot deep in the veins of the legs, that is deep venous thrombosis DVT. Cellulitis in the lower leg has signs and symptoms of the deep vein thrombosis DVT, such as warm, pain and swelling, inflammation. If occur, one have to think of that. Now, the differential diagnosis of the cellulitis is deep venous thrombosis, do a compression leg ultrasound, stresses dermatitis, inflammation of the skin from the poor blood flow, Lyme disease, characteristic bull's-eye rashes there, and that is the key of diagnosis. Necrotizing fasciitis, necrotizing fasciitis because of the flesh-eating bacteria, gas gangrene, purple bully, skin sloughing, subcutaneous edema, and systemic toxicity. Acne conglobata. Here one can see the deep vein thrombosis and the stresses dermatitis because of the veins not working properly, acne conglobata, and the other bull's eye, one can see the rash in the Lyme disease, and one can see the gas gangrene, the gas under the skin, and that gives you the appearance of the bubbles under the skin. So that is gas gangrene. Now, erysipelas, in contrast to the cellulitis, it is a bacterial infection involving more superficial layer of the skin. I have already shown you a slide previously in which erysipelas have been shown. It presents with an area of the redness with well-defined edges, mostly associated with a fever, hidradenitis suppurativa, and pilonidal cyst. Syndrome is called follicular occlusion triad or tetrad. So here one can see again the cellulitis, deep and erysipelas just going up to the dermis, and the abscess and this hidradenitis suppurativa, and this is erysipelas. One can see the red color of that. It is the beauty of the nature to make these kind of the vegetables which one cannot think, but sometime it can be seen rarely, and this looks so beautiful that one carrot is embracing the other. Now to the treatment, rest the area, elevate area to ease swelling and discomfort. In the past, it was said to be the rice strategy, and that is definitely the rest and elevation and compression. So here, use pain reliever like acetaminophen or ibuprofen to ease pain and fever. Use oral antibiotic or IV or intramuscular antibiotic if the infection worsens and you are thinking that it is going to be a serious problem. Antibiotics are selected based on suspected organism and keeping in mind what bacteria could be responsible for causing this problem, and you fire the antibiotic against those particularly specific antibiotic against those bacteria for the proper care, and just see the presence or absence of the purulence and then decide if there is abscess, drain the abscess. And in penicillin resistant semi-synthetic penicillin or a first generation cephalosporin is recommended for cellulitis without abscess because the bacteria produce penicillin, so penicillin resistant bacteria are there. So do use cephalosporin. Bacteria are not resistant to this. Surgery rarely in severe cases to open and drain an abscess, and sometimes the incisions are given to release the tension of the skin over the underlying structures like blood vessels, nerves, and veins. Pus collected in tissue cut away dead tissue to allow the healing. Steroid speed the recovery in those on the antibiotic. So here one can see the injection is given, and that is the local is given, and then incision and drainage to drain out the pus, and the medicine which is useful in this case are cloxacillin, oxacillin, nafcillin, dicloxacillin, oxacillin, methicillin, and similarly first generation cephalosporin like cephalexin, cefadroxil, and cephalosporin are also the drug of choice. Cephradine, these are given. Sometimes the ceftazine and ceftrapin are also useful as antibiotic. Now the prevention, practice the good personal hygiene and keep your skin clean. Wear sturdy, well-fitting shoes or slippers with loose-fitting cotton socks. Do not walk barefoot outdoors. Wash the injured skin with soap and water. Make sure it heals over the next few days. Some injuries have a higher risk for the cellulitis than others, animal or human bites. And continuing prevention, puncture wounds deeper than a half inch, such as from stepping on a nail, crushed tissue that bleeds, burn the blisters, frostbite, deep injuries with dirt in them, diabetes, other medical conditions such as liver or the kidney disease, swelling in the arms and legs that does not go away, and wash the wound daily with soap and water. Apply a protective cream or ointment. Cover the wound with a bandage. Watch for the sign of infection, irritation, pain, and pus. All signals infection is there. People with diabetes or poor circulation need good skin care and good treatment. Inspecting the feet daily and moisturize the skin regularly. It prevents cracking and peeling. Trim the fingernails and toenails frequently, protecting the hands and feet. Wear the footwear and suitable gloves. Promptly treating infection on the skin surface, such as athlete foot. Treat the fungal infection as soon as they occur. So that is the end of the cellulitis. Hope so you have liked this. If you have liked this, please subscribe this and just share it with others. If you don't like, you just ask for me and ask any question. I will not hesitate. And thank you very much for patient listening and seeing